I am Dr. Neelima Padmanabhan, obstetrician and gynecologist with more than 25 years of experience, specialized in cosmetic and functional gynecology. Passing urine without control is called stress urinary incontinence. Stress urinary incontinence is a condition in which patient leaks urine or passes urine involuntarily without her control, especially during coughing, laughing, sneezing, or any other condition in which there is increased intra-abdominal pressure. Stress urinary incontinence is seen in patients following childbirth, elderly women, and in postmenopausal women. Stress urinary incontinence is mainly caused because of pelvic floor muscle weakening. Stress urinary incontinence is passage of urine involuntarily during activities like coughing, sneezing, laughing, or any other activity which increases the intra-abdominal pressure. Whereas urge incontinence is the condition in which the patient passes urine or leaks urine even before she reaches the toilet once she gets the urge or sensation to pass urine. Mixed incontinence is a condition in which both the above conditions coexist. Yes, pregnancy and childbirth can lead to urinary issues during pregnancy and post-childbirth as well. These urinary issues arise due to the physical and hormonal changes happening during pregnancy and the mechanical impact of childbirth. Pregnancy and childbirth cause pressure on the urinary bladder and changes in the pelvic muscle strength, leading to the urinary issues. Yes, hormonal changes during menopause can affect the health of the urinary tract and reduce the bladder control. Changes in the hormones, especially when the estrogen hormone reduces in the body, can lead to changes in the urinary tract wherein there is reduction in the bladder control, there is thinning of the urethral epithelium, there is reduction in the tone of the urethral sphincter, and bladder capacity is also reduced. All these changes lead to the urinary issues during menopause. Reduction in the collagen content and the quality, and reduction in the elastin fibers with age contributes to the weakening of the connective tissue surrounding the urinary bladder and the valve of the urethral sphincter. These changes lead to the symptoms of stress urinary incontinence and urge incontinence in the elderly ladies. Yes, doing exercises regularly can help control or prevent urinary issues to a certain extent. Kegel's exercise is the most important of them. Kegel's exercise is done by contracting the pelvic floor muscles as if the woman is trying to stop the flow of urine and holding it there for 3 to 5 seconds, and then gradually relaxing over the next 5 seconds. Try to increase the hold time for 10 seconds. Perform 3 to 5 sets daily with a count of at least 10 to 15 times in each set. Doing these exercises regularly over a period of few months can improve the urinary issues in many women. Apart from doing regular Kegel's exercises and pelvic floor muscle training, for mild to moderate cases of urinary issues, we have the vaginal laser treatments, the vaginal electromagnetic stimulation therapy, and PRP injections. These treatments can be used either separately or as a combination to manage the different degrees of urinary issues in women. Laser treatments especially are non-invasive, have got minimal pain with quick recovery and hardly any downtime. Though the patient has significant improvement in the symptoms following 2 to 3 sessions of the laser treatment, but however, it is recommended to complete the prescribed number of sessions so that the patient has long-lasting results. The laser is applied to the vaginal wall surrounding the urethra to stimulate the weak tissues and the underlying pelvic floor muscles. The laser treatment has two main effects. It causes increased production of collagen fibers and elastin fibers, which lead to increase in the tone and strength of the vaginal tissues and also the pelvic floor muscles. Laser therapy also helps in collagen remodeling. Laser improves the blood circulation in the treated area and also helps in tightening and strengthening of the tissue supporting the urethra and also strengthening of the pelvic floor muscles. The electromagnetic chair is a device designed to assist in the management of urinary incontinence in women by using high-intense focused electromagnetic stimulation. This device generates electromagnetic pulses directed towards the pelvic muscle floor area. This device, when in use, generates muscle contractions which are equivalent to doing Kegels exercises, though much higher in intensity and frequency. One single session of 30 minutes in this chair is equivalent to doing 12,000 Kegels exercises. This causes improvement in the tone and strength of the pelvic muscles, which is important in the bladder control. Platelet-rich plasma injections are an emerging non-surgical trend for managing urinary issues in women. Platelet-rich plasma injections are a concentrate of platelets prepared from the patient's own blood. It contains growth factors and proteins which help in tissue regeneration and healing. These injections are injected into the urethral wall and into the vaginal wall surrounding the urethra, which promotes healing and regeneration. Once the PRP injections are prepared, they are injected into the vaginal wall surrounding the urethra, which promotes healing of the tissues and regeneration of the tissues, increasing the tone and strength of the pelvic floor muscles, which is very important for bladder control. I am the medical director of Current Care Hospital at Hormao, Bangalore. Our motto is affordable healthcare to all without compromising on the quality. Cosmetic gynecology or aesthetic gynecology is the latest and fastest growing subspecialty of obstetrics and gynecology, which focuses on the functional and aesthetic aspects of female external genitalia. Cosmetic gynecology at the outset looks like it is only for the rich and affluent class of patients. But we at Current Care Hospital would like to break the myth and make it affordable to everyone.